So if you get Botox just in your forehead, typically one of the most common areas that we look at as injectors is the eyebrow. So you have opposing muscles. It's kind of like a tug of war. You have muscles that pull your eyebrow down, and you have muscles that lift your eyebrow. The forehead muscle lifts your eyebrow. So if you're only getting forehead Botox injections and you're relaxing that muscle that lifts your eyebrow, the muscles that drop your eyebrow will always win. And so over time, you can have a very low eyebrow, which is not aesthetically pleasing. That's why it's important to go to a trained injector, because it's very rare that you would just treat the muscle that lifts the eyebrow, because we know that it's going to lower their eyebrow position, which is not a great result. So one of the most important things to consider is the position of the eyebrow, prior to injections of Botox. A trained aesthetic professional who knows, which muscles are acting on the eyebrow in which way knows how to treat certain areas. So just injecting Botox simply just in the forehead or injecting it too low into the muscle of the forehead, what that's going to do is it's going to allow the muscles that lower the eyebrow kind of win in the tug of war. You're going to have a low eyebrow position, which is not youthful or not aesthetically pleasing. So it's really important to kind of go to a professional who knows, which muscles anatomically are pulling the eyebrow in which direction. Sometimes, we have patients who come in and, they were recommended, or they just say they want, only forehead Botox. And I like to talk through the process with them and explain which muscles are pulling in which direction. I like to show them their eyebrow position. And sometimes just treating one muscle that simply lifts the eyebrow, I warn them that it's not the best idea, because the muscles that kind of drop the eyebrow are going to win, and they're going to have a very low set eyebrow, which I think they're not going to be happy with. It's not an aesthetically pleasing result. Botox is not simply just about fine lines and wrinkles. You have to know facial anatomy. You have to know, which facial muscles are pulling your face in which way. The goal there is to treat the entire face so it's harmonious and aesthetically pleasing. So Botox can change your face by acting on specific targeted muscles of facial expression. And that's why it's really important to go to somebody who knows the anatomy of the facial muscles and knows which muscles to target with a specific targeted number of Botox units. Common areas that are treated are the forehead muscles, the glabella region, which is kind of like in between your eyebrows, and these crow's feet, which are your orbicularis oculi muscle. These are really probably the three most common areas that I treat in my practice with Botox. And it's important to know which muscles are pulling in which direction, because it can give you, the ideal optimal aesthetic result. Treating specific areas of the face with Botox can potentially alter certain anatomic areas of the face. So one example is the eyebrow. The eyebrow has multiple muscles that act on the eyebrow. Some elevate the eyebrow and some lower the eyebrow, and these are normal. So if you just treat a muscle, for example, that elevates the eyebrow, and you allow the muscles that lower the eyebrow take over, what you'll have after Botox is not an ideal result, because you'll have a low eyebrow position, which is associated with aging, and it's just not as aesthetically pleasing. The best way to get an ideal Botox result is to see somebody who's trained in Botox injections, who understands facial analysis top to bottom, who understands facial anatomy and musculature and how each muscle works on the face. It's really important to see a trained professional for your Botox injections. In my experience, plastic surgeons who have completed a plastic surgery training program, we get trained in not only Botox and fillers and other things, we get a very deep training of facial anatomy. So then when we do learn how to perform Botox injections or any other injections, we know exactly which muscles we're treating, why we're treating them, because of our understanding of facial anatomy is thorough. Any trained medical provider can perform Botox injections. It's up to the patient to, seek out who they're most comfortable with. Somebody who understands facial anatomy and facial analysis is probably the ideal person to perform any facial procedure, whether that's surgical or non-surgical like Botox. But ultimately, it's up to the patient to seek out, a trained provider who knows exactly what they're doing.